This is Manu and Kalia, physical therapist and Ayurveda herbalist. So I'm going to show you guys a pretty cool mobilization or stretch of the knee for getting your bending or flexion back. Okay, so let's just quickly look at this knee here. So remember, your knee is the joint itself is comprised of your femur, right, which is the top bone, and your tibia, which is the bottom bone, right? So it's the gliding and the rolling motion that takes place within these two bones that's facilitating or resulting in that extension, which is straightening, and flexion, which is the bending movement. So that's the bulk of the movement. However, there is a little bit of external and internal rotation too. External going outwards, internal going inwards. Okay. So for example, for external, for extension or straightening it out, there needs to be a little bit of external rotation also to bring it into a full extension. And at the same time, for flexion, you need to have a little bit of internal rotation there too. So a lot of times, focus is given just to the flexion extension components, and people forget the internal and external rotation components of the joint too. So especially for bending purposes, I find the stretch I'm going to show you guys to be quite effective for getting that bit of a weight-bearing or loaded flexion back. More of a functional stretching position too. So what we're going to do is I even use steps, a couple of steps, or I'm going to use this box right here. So what I'm going to do is I'm going to have my foot right here. Let's say this is the knee that's involved. I'm trying to get the bending back, right? So my hand is going to, the outside part is going to sit just behind the knee or underneath the knee, right, on your tibia. So what I'm doing is the range that I'm looking for is I'm trying to get my bending back, which is restricted or tight, whether it's the joint capsule, some soft tissue stuff, myofascial restrictions. So what I'm going to do is I'm going to do a little bit of a glide or rotation going in this direction. I'm rotating my tibia essentially, internally rotating it lightly. Not too hard, remember, you're not trying to throw yourself off, okay? So a little bit of glide through here, okay, firm though, in the front here and then back through here, and then I bend forward, right? I bend forward, so I'm shifting my weight forward. The good thing is, bulk of my weight is not on the knee, so if your knee is a little bit problematic, right? So bulk of the weight is still on the back leg. So it works quite well. I can get there and I can stretch, 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 come back out of there. Stretch, 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 come back out of there, okay? So it restores a lot of that bending quite effectively, okay? In the early acute stages, this might be a little too much, but if you're looking to get, once you're past that acute stage and it's not that irritated, the joint, then you can definitely use this stretch to really get a lot of that residual limitation in your bending that might be there, okay? So I find this to be quite effective, and it's relatively easy to do. Just got to make sure the heel of the hand sits right behind here, the other hand's here, bend and rotate at the same time. It's called mobilization with movement, okay? So it's very effective. So I hope you enjoyed that and you find that helpful. And if you have any questions, make sure leave a comment and click on the link below to subscribe to the channel.